Well, this is Dr. Leonard Cupo, and I will be interviewing you today. You'll be my interviewee, and I am excited for this.
Me too.
So, first question, how old was your father when he was diagnosed with Parkinson's disease?
My dad was 80 years old when he was diagnosed with Parkinson's disease.
That's older than my dad. Yeah. My dad's 16.
Usually it occurs in people older than 60, but it can occur at younger ages as well.
Yeah. My dad got it when I was in kindergarten, and I'm in 5th grade, so that is a little bit younger. It's a little bit younger than the average age, but still it's more in that general area. Your dad was much older when he got Parkinson's disease, which means he was a bit luckier because he got it later. Anyways, second question, did you notice symptoms before the diagnosis? What were they?
Yes. Looking back, my 3 sisters, and I, and my mom noticed some changes in my dad. We noticed that he moved slower, he talked slower, he fell one time, which was unusual for him because he was always very careful. So looking back, and he also lost expression in his face because he was a very happy, talkative, smiling guy, and what happened was, he lost some facial expression. Yeah. And if we think about it, we think it started perhaps 4 or 5 years before, so maybe when he was about 75 years old. But we did not think he had Parkinson's disease. It never even came into our mind because we thought, well, Dad is getting a little older, and he had a few other medical problems, and we thought maybe it was because of his diabetes.
Okay, that's interesting. Number 3, how did you help your father?
It was a team effort. It was a team effort among my 3 sisters, my mom, and me in the beginning. Of course, I lived far away, but I tried to help as much as I could, and I traveled there once or twice a year to help out. We kept him exercising to keep his muscles strong. We made the house very safe so that there was less of a chance of him falling. We used to have kind of a cluttered house, and they lived in a smaller house since all the kids got older, so they tended to stuff a lot of things in there. So we made sure that the clutter was gone, that the walkways were clear. We made sure that there were lights on at night so that he could see where he was walking. We fed him healthy food. We tried to give him enough food, including protein, so that his muscles would stay strong in combination with his exercising. We brought him to the doctor. We brought him to a specialist in Parkinson's disease, a neurologist, and she prescribed medication for him. We also got some help eventually because my sisters they have jobs and they have children, and I'm far away, and my mom was getting older, so we got some helpers in the house who were nurse aides, and they helped with my dad as well, doing all of those things. And I forgot to tell you this, but I mentioned it when I wrote it. We loved him a lot. We reassured him and we told him not to worry, that we would take care of him, and we're going to keep him strong. And we just loved him a lot.
Okay. So, 4th question, what medications did he take?
The only medication that my dad took is Cinemet.
Cinemet?
Cinemet, yes.
I feel like I think I've heard that in one of my articles that I read up about on Parkinson's disease. Isn't it like, is it a dopamine agonist?
Yes, it is. That's exactly what it is.
Yeah.
It's a combination of L-DOPA, levodopa, and
Yeah.
carbidopa, so it's a combination medicine. And the carbidopa prevents the breakdown of the levodopa, so more of it gets into your bloodstream and into your brain. And one of the problems with Parkinson's is a loss of dopamine in a certain part of the brain. Yes.
I know, like, there's a part of the brain that creates dopamine, and it makes basically, it controls like smooth movements, like, you know, like walking and stuff like that. But Parkinson's disease affects that part of the brain,
Yes.
so less dopamine is produced, and the movement becomes more rigid and slower, and of course there's the shaking.
Exactly. So the idea of the medicine is to put some dopamine back into that part of the brain called the substantia nigra. It's called the substantia nigra in that part of the brain to combat exactly what you were talking about. And it does work, and it did help my father. So he was able to move smoother. He was able to do a lot more things in his life, you know. My dad did not have much of a tremor, but he did have slowness, and that helped a lot with that.
Thank you for the water, by the way,
You're welcome.
and thank you for your time.
You're welcome.
Now, I already know the answer to the question, but number 5, was there anybody else helping him?
Yes, a lot of people, as I told you. It was a lot of family members, and as I say, we did have 2 helpers also, nurse aides that helped us. Yes.
Yes. Okay. Does anybody else in your family, other than your dad, suffer from Parkinson's?
Yes. My father's first cousin has Parkinson's. Not as severe as my dad, but he does have it. And it turns out that my mother's sister, who is my aunt, who's not a blood relative of my dad, also has Parkinson's.
Wow. So, now number 7, this kind of links to the your last question's answer. Is Parkinson's hereditary in any sort of way?
Yes, it is believed. Now there's a lot of evidence to indicate that in a significant number of cases of Parkinson's disease, there is a genetic component, meaning that it's inherited. Okay, and but not all cases, it seems, but a significant percentage. The estimate is that maybe 15% of cases of Parkinson's disease is strongly genetic, is inherited. Yeah. And that leads to the thing that we had been talking about with the families in Italy, in Contursi, Italy.
So, why do people with Parkinson's lose their voice? Did your father lose his voice?
Sure. Well, the reason that people with Parkinson's lose their voice is because the talking requires the action of muscles. And just like other muscles in the body are affected by Parkinson's, such as the muscles of your hands, your legs and your arms, the muscles that affect your ability to speak, which are muscles in your
Vocal
throat.
cords?
There are muscles that move the vocal cords, exactly. The muscles that control your ability to speak and to swallow are affected by Parkinson's. And so that did affect my dad, so my dad's voice became softer. My dad's voice became, he had difficulties, he had breaks in his words. And eventually he didn't like to talk too much because it became difficult for him.
Yes.
And so did swallowing. You know, you were talking about the genetics of Parkinson's disease, and I can tell you a story about that, because my dad was born in Italy. My dad was born 15 minutes by car from the town called Contursi, Italy, which is where a lot of studies have been done to figure out the genetics of Parkinson's disease. And there is a neurologist in New Jersey whose name is Lawrence Golbe, and what his story is that when he was finished his training in neurology, he got involved in a study of Parkinson's patients to study the genetics of Parkinson's disease. And he noticed that there was a family that was in New Jersey in which two brothers had Parkinson's disease. And he decided to do an inquiry on that to see if there was possibly more information that he could gather so that he could figure out the genetics of Parkinson's disease. And he teamed up with doctors in Italy, and he figured out that where these two brothers came from, this town of Contursi, there was a lot of Parkinson's disease. And he tracked down the people. Some of the people moved to South America, so he had to work with doctors in South America. Some of the patients moved to America, other places in America, and he tracked them down. And he found out that there were families from Contursi that had a high incidence of Parkinson's disease. He found that out because he was thinking, and he did studies on that.
Well,
And he traced it to this couple, a man and a woman, who lived in Italy in the 1600s. And they were the original mother and father, and they evidently passed on the genetic problem that led to Parkinson's disease in the rest of their family members. So Dr. Golbe figured that out. Not only did he figure that out, but Dr. Golbe later worked with molecular biologists and figured out exactly where the problem was. They figured out that the problem was on the 18th chromosome of the human body. There are 46 chromosomes in each of our cells. On the number 18 chromosome, there was a problem. And then further studies showed that there was a gene that made a protein called alpha-synuclein that was defective, it wasn't made right, in patients with Parkinson's from the families from Contursi, Italy. So it's all because of that Dr. Golbe and his thinking and wanting to do an inquiry to figure out the genetics of Parkinson's that we know now that a problem with Parkinson's disease is the accumulation of this protein called alpha-synuclein in that area of the brain called the substantia nigra, and that causes those cells to stop making dopamine, which leads to Parkinson's. And 50 to 75% of the research now in Parkinson's is being done on that protein, alpha-synuclein, to try to figure out how we can find a way to prevent, slow down, and cure Parkinson's disease, all because of that doctor keeping his eyes open, thinking, I'm going to study this. That's what Mid-Pacific is trying to teach you to do and to be like. So that when in your life, when you get older, when you see something, you can say to yourself, I'm going to look into this. I'm going to do an inquiry like I used to do in 5th grade and figure this out.
okay. I have one question left. So, what activity did your father miss the most once Parkinson's disease progressed inside of him?
As I told you, my dad is Italian, as am I. And Italians love to eat. A lot of people love Italian food. Pizza, pasta. And my dad loved to eat food and Italian food. And so the thing that my dad missed the most was eating Italian food.
Why couldn't he?
He could in the beginning, but then he had difficulty swallowing. And so he didn't want to take the chance of choking on his food. So what we did in the beginning was we gave him, of course, we helped him and fed him, but we cut it up and made it so that it was less likely to cause him to choke.
That's what we do with my dad.
Exactly, yes.
Thank you, Dr. Cupo.
You're so welcome.
It's
I really think it's great that you're doing this capstone on Parkinson's. I think it's great that you have spent all this time and effort to do it. I think
Yeah.
it's also great that you're helping your dad. That's really beautiful and wonderful.
Mhm.
And I know that one day you'll have your eyes wide open, and whether it's finding something about Parkinson's or whatever else you are interested in, you'll make a contribution to the world and maybe science if you become a scientist or doctor.
Yes, I'm thinking about becoming a doctor. Anyways,
If
thank you again, and you can...
If you need any help, I'm here to help you.